tensions tend to rise and things can potentially escalate. So it's just important for people to know that we're still providing services, even though most of them are provided virtually.
That was Marky Pickett, Communications Manager for the Dove Center in St. George, back in November, talking about the increase in domestic violence cases down in southern Utah during the COVID-19 pandemic. Welcome to our In Focus discussion tonight on funding Utah's domestic violence shelters. Domestic violence shelters across the state were informed to be prepared for a 25% cut in funding awarded by the Utah Commission for Criminal and Juvenile Justice from the Victims of Crimes Act. What kind of impact is this going to have on our shelters as well as victims and survivors? Joining us live now via Zoom is Lindsay Boyer, the Executive Director of the Dove Center in St. George. Lindsay, thank you for your time tonight and welcome to the show.
Thank you, Rosie.
Lindsay, I'd like to start by talking about the impact. What kind of impact did the Dove Center experience from the COVID-19 pandemic?
You know, much like our sister shelter programs around the state, we've all experienced increases at some point or another. And for Dove Center specifically, we've experienced at least up to about a 50% increase in a number of different program areas. And it's remained above average for most of the year since the pandemic hit. So we've stayed pretty busy. We've also been able to convert to a telework model, like a lot of other agencies, a lot of other businesses, which can make things a little tricky with serving survivors. You know, there's a privacy concern and safety issues we have to take into account. So we've just been trying to adapt and be flexible and remain available and you know, remove as many barriers as we can. But we've definitely seen an increased need, especially with the number of crises our clients are experiencing and the intensity of the crises they're experiencing with domestic violence escalation and other forms of abuse and assault.
50% is a big increase. Do you know what factors may have contributed to the rising number of victims and survivors needing help?
Well, the dynamics with domestic violence is, you know, with the power control dynamic, there's more isolation and there's more access to monitoring and controlling the dynamics of the household. And when you have families that are quarantining and home more often, and kids who aren't in school and who are at home more often, there's more you know, tension rising, and there's more exposure to the cycle of domestic violence. And these risk factors just kind of create a pressure cooker, and unfortunately it limits access to resources and limits access to support systems and to resources like the organizations you know, that serve survivors like Dove Center.
What kind of impact would it have on the Dove Center to lose 25% of federal funding, especially since it is the only victim services agency in the area?
Yeah, it's definitely a big hit for all of our programs. For the Dove Center, it would be well over about $100,000, which, you know, in what that might look like is at least 2.5 of our advocates or counselors that, you know, that's what we do. That's the business we're in, is being here to serve and to provide assistance and support and help survivors with their healing journey and safety planning. And we need every person we have, and we need more. And so to have a big cut like that is very destabilizing and disruptive to the existing services. And so many survivors don't have family or support systems to turn to. So we're it. And you know, already being underfunded, we can't afford to lose anyone or any of our program assistance like housing or financial emergency assistance. So it's pretty concerning.
Let's talk about the risk of lethality calls and the lethality assessment protocol. Could you help explain what that is to our viewers?
Yeah, so the lethality assessment protocol it's basically a partnership between your first responder, mostly law enforcement agencies, and community-based victim service providers similar to Dove Center, who provides shelter and emergency 24-hour care so that victims who are at high risk of danger have an immediate connection to a service provider. That way they can access safety immediately, and the connection typically doesn't get made, especially in that moment of the intensity on scene. You know, survivors aren't thinking about calling a victim advocate, but when an officer tells you, I'm worried about your safety and I want you to talk to someone, that goes a long way, and it really it means a lot to a survivor. It speaks volumes to a survivor to hear that, and then to get on the phone with an advocate and to learn about a resource. That's huge. And we've seen in Washington County the impact that's had with our LAP partnerships and what that's been able to do for a number of survivors that we hadn't served otherwise, or that may not have accessed services otherwise if it wasn't through a law enforcement referral through the lethality assessment screening process.
Lindsay, we have about 30 seconds left. I'd like to give the final word opportunity to you. What would you like our viewers to know who are watching tonight?
Well, first, I just want to thank our media coverage for these issues over the past several months. You know, we've had a lot of coverage, and I think that's critical for our communities and for the general public, for our elected officials, for community leaders, anybody who has a position of influence. But that can even just be our neighbors and family members and friends, because it really does take our entire community to pull together and to make a change and to be a part of shifting culture and addressing these issues. We need every single member of our community to take ownership and to become a part of it. So I would just say, be curious, be interested, see what you can learn, and reach out if you need help.
Well said. You've been hearing from Lindsay Boyer, Executive Director for the Dove Center in St. George. Lindsay, thank you for your time tonight and for all that you do for domestic violence survivors.
Thank you, Rosie.
A cut like that really means that it destabilizes our ability to provide safety for victims.
That was Jill Anderson, Executive Director of CAPSA in Northern Utah, back in December, talking about how domestic violence shelters across the state will lose 25% in federal funding awarded by the Utah Commission on Criminal and Juvenile Justice from the Victims of Crimes Act. Thanks for staying with us for our second In Focus discussion tonight on funding Utah's domestic violence shelters. Joining us live via Zoom now is the person you saw at the top of the segment, Jill Anderson. Jill, thanks for joining our discussion tonight. It's good to see you.
Good to see you, Rosie. Thank you.
Jill, let's start with the statistics. This is a three-part question. How many women experience domestic violence in Utah? How does it compare with the national average? And how many end up homeless?
Right. In Utah, the statistics are 1 in 3 women will experience domestic violence in their lifetime. Nationally, that number is 1 in 4. And so Utah has a higher rate of domestic violence than nationally. And in terms of homelessness, over 63% of women and families who experience homelessness have experienced domestic violence.
Now, these are staggering numbers, especially the fact that we are above the national average. What are the 3 most significant impacts that domestic violence shelters across Utah are facing, or what are the impacts that created the perfect storm to jeopardize shelters' abilities to provide services?
Right. Well, in addition to the 25% cut that we're facing in federal funds and the COVID, the increases in requests for services due to COVID, we are also, Utah is one of the fastest growing states in the nation. So that population increase alone contributes to those increased demand for services. And we've also talked about LAP and our partner enforcement. While it's one of the most proven ways to ensure victim safety and hold offenders accountable, that partnership between law enforcement and community-based services is so critical. But it is pushing more victims into our programs across the state and our shelters across the state. And so those are the 3 biggest impacts: that cut, along with COVID increase, along with that LAP partnership with law enforcement just creates the perfect storm and really jeopardizes our ability to continue to provide for safety.
Now, what kind of impact would it have specifically on CAPSA to lose out on the money because of the 25% cut from the Victims of Crimes Act?
So we're looking at losing a number of critical positions within our organization that provide 24-hour crisis intervention, shelter, and support for victims. And it really does, impact our ability to continue to provide for the safety for victims and be available 24 hours a day for victims and respond in that way. And so we're looking at losing a number of our advocates, our counselors to because of this loss.
Every domestic violence shelter in Utah received $80,000 each from the CARES Act. Now, how long did that amount last, and was it enough to get you through most of the pandemic?
It was enough to get us through the last 6 months. You know, every shelter, community-based organization like CAPSA spent every single penny of that $80,000 that they received. And there's no way we could have gotten through the pandemic without it. But we know that the impact of the pandemic is going to continue on long-term for a while now. Even with vaccines coming out, we know that the pandemic has impacted families in significant ways, and we expect to continue to see those expenses and increased requests for help for some time to come now.
Tell us about how you are turning to the state now for financial assistance and what your efforts are with other shelters in Utah.
So we're working together as 14 private nonprofit community-based shelter organizations to request the state step in and help us with this loss, this program loss is what we're facing. And it's just critically important. You know, these programs have developed and established these needed programs in our community, and our community relies on them. And in order to keep our communities safe and families safe, we need to be able to continue to provide that service and that response. And so we're asking the state to help ensure that those programs are stabilized.
All right, you've been hearing from Jill Anderson, Executive Director for CAPSA in Logan. Jill, thanks for being a part of our discussion tonight and for all you do for domestic violence survivors.
Thank you, Rosie. We appreciate you covering the story.
Anytime.
We'd be facing significant cuts if we can't get that replaced in the next few months.
That was Margaret Rose, Executive Director of the YCC Family Crisis Center back in December, talking about how domestic violence shelters across the state will lose 25% in federal funding awarded by the Utah Commission on Criminal and Juvenile Justice from the Victims of Crimes Act. Welcome to our third and final In Focus discussion tonight on funding Utah's domestic violence shelters. Joining us now live in studio is the legislative sponsor for the state funding request, Representative Dan Johnson of Logan. Representative, we know it's a busy time for you because of the active legislative session. Thank you for making time to be here tonight.
Rosie, I'm glad to be here and to cover this important topic. Thank you.
Could you tell us how you became connected with this cause? What prompted you to become the legislative sponsor for the Domestic Violence Essential Services funding request?
You know, I spent a lot of time working with kids and families in my career, and I got kind of hooked up through some of that with CAPSA in Logan, and in my legislative work, I began to see that there's a need for these private-public partnerships, the 3 Ps, so to speak, and CAPSA was one of those that I became engaged with, and even this summer, I noticed that there were some funding issues with the CARES Act, where nonprofits could be funded, and so I reached out to them and come to find out a little bit more about the 14 centers across the state and was able to find some funding for each one of them.
Could you provide a brief summary about the funding request? Do we know details such as the amount of money requested, how long the state funding would be provided, and where the money will come from?
Yeah, you know, that's a great question. The funding request is an ongoing request, and it'll come out of general fund money for about $3.6 million, distributed across those 14 different centers across the state. And so it does get divided up. It's an amount of money per year and ongoing. So if we can get that in place, it builds some stability for ongoing funding for all the shelters across the state.
Now, for those that are not familiar with the legislative process, a funding request is different than a bill. What will the process for this funding request look like, and what needs to be done for it to be approved?
Yeah, what happens during the first 3 weeks of the legislature, we spend a lot of time in meetings looking at appropriations, and you can fill out an appropriation request like I have done in advance, and these organizations provide me data and statistics and information about how they will be held accountable and will show, you know, what they're going to do with the money. We get that packet together and we present it. Matter of fact, this Thursday, CAPSA will present along with the other organizations for this funding request. And then Executive Appropriations takes all of those requests and looks at the total state budget and then tries to identify how it is that you know, they can fund these individual requests. So it's not a bill where it goes to House and then to the Senate. It goes through an appropriation approval process.
Now, we know there is a meeting with the Social Services Appropriation Committee on Thursday to review this funding request. Are you optimistic that it will be approved?
I have a lot of faith in this, and the reason for that is because this funding request is so well put together from the beginning to the end. And one of the things that's really important about any funding request is that you have markers for how it's going to be evaluated and a way to provide feedback. And this money goes to real specific sorts of uses. It's tracked, and so there's a lot of accountability in it. And I think that folks that sit on that committee are gonna like this.
In your opinion, apart from this funding request, is there more that needs to be done for our domestic violence problem in Utah? What else would you like to see in the future to improve resources and support for victims and survivors?
I think just in general, it's kind of this idea across our state, in any sort of institutions that we have, we need to promote you know, families and taking care of children and getting people to be independent and willing to take care of themselves. It's sort of this culture that we need to promote. But also, you know, there need to be more counselors, there need to be more nurses, there need to be more health care workers, social workers, people who are available, trained for these kinds of situations, so that, you know, when people need help, it's just not random help. It's very targeted, and it's with people who know what they're doing.
Representative Johnson, about 1 minute left. Final words for you. Anything you want to mention? What would you like our viewers to know about this subject tonight?
Yeah, well, it is such an important subject, and I'm thankful that you asked that. But, you know, I think one of the most important things is that you have to realize there are these organizations that are nonprofit. They work 24/7 behind the scenes. And things are going on that a lot of people don't really know that's happening, because it's very quiet and it's private. And you know, when there's fundraisers, reach out and help them. Get to know these different sort of agencies that exist in your community, because one of them is nearby in your community. And reach out and you know, help them by volunteering, and also by making some donations when you can.
Great final words. You've been hearing from Representative Dan Johnson of Logan, the legislative sponsor for the state funding request for domestic violence shelters. Representative, it was great to have you on the show. I know you've been up all day. Thank you for making time for us tonight.
You bet, anytime. Thank you, Rosie.
Thank you.